Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute, where we specialize in the evaluation and comprehensive testing and successful treatment for chronic thyroid conditions, which typically have not responded to traditional medical care. Today we're going to be talking about secret number 7 in our continuing series of how to overcome chronic thyroid disorders. And today we'll be talking about something important to check on a blood test, and it's called TPG. TPG is what's called thyroid binding globulin. Your liver makes it. There's little proteins that will bind onto the thyroid hormones, and they'll carry them throughout the body. Now, these bound proteins are inactive, so they don't really have any metabolic activity. It's the free hormones that will actually enter the cell. So if we have too many of these thyroid binding globulins, what's going to happen? There's not going to be enough free T3 to get in the cell, and you're going to get low thyroid symptoms. Now, unfortunately, this is often not checked. And so let's actually make a list of all the thyroid tests that someone who has thyroid problems or thinks they have should test. We should check for TSH. We should check for total T4, total T3, free T3, free T4. We should also check for the antibodies, because we want to find out if you have autoimmune, which is very common. And we also need to check for something called T3 uptake. Now, there's an inverse relationship between T3 uptake and TPG. So if your TPGs are high, you're going to have a low T3 uptake, and vice versa. So that's a very important thing to check. And remember, the functional range is going to be the range we're going to look at. The pathological range is going to be way too high. Now, what would cause the body to produce too many of these TPGs? Well, what happens is that a woman may be taking birth control pills or some type of a hormonal replacement, typically estrogen. Lots of women also don't know that face creams and cosmetics sometimes have estrogen in them. So if our estrogen levels are rising, it will cause the liver to make too many of these thyroid binding globulins, and then we're not going to get the free T3 into the cell. Now, your liver is something that's going to help detoxify your hormones. So you could have elevated because of what you're taking. Either you know about it or you don't know about it as far as estrogen goes, but your liver is going to help break down those estrogens to keep them from getting high. So a person could have a sluggish liver and not be breaking down those hormones, and that could be the reason why they have high TPGs and, again, low thyroid symptoms. So in our comprehensive evaluation, we're going to check liver function. If our numbers show that we have a sluggish liver, we're going to put patients on supplements to help them, overcome that. So the important thing to know about thyroid testing is making sure that you're getting all of the tests done. TSH alone is just not near enough. You could have high TPGs and have a normal TSH and not even know you have the problem. So the bottom line is you need to see an expert. See an expert like myself or other trained doctors who specialize in thyroid conditions and know exactly what needs to be done to help you get better. So if you're ready to make the change and get your life back on track, give our office a call at 425-821-1101 and schedule your free 2 visits. Now, next time we'll be talking about our number 8 secret to helping you overcome your thyroid condition.